Start the recording. Excellent. Okay, welcome everybody to the Seneca County Board of Health meeting, May 26th. So could we take a roll call for everyone present?
Dr. Akers. Mrs. Boroff.
Here.
Mr. Logston.
Here.
Mr. Lyons. Mrs. Posey is excused.
Okay.
Mr. Steyer.
Here.
Mr. Watson.
Here.
And Dr. Wolf.
Good. All right. Thank you. With that, I guess we be the Pledge of Allegiance. So you have the flag available there. So join me with the Pledge of Allegiance, please. Pledge allegiance
to the flag
of the United States of America and to the republic
for which it stands,
one nation under God, indivisible, with liberty and justice for all. Thank you. Okay. So on the first item on the agenda, showing that we're going to get a presentation from Chris Lunn, our consultant, environmental consultant. I'm looking forward to that. So everybody, welcome Chris. Take it away, please.
Thank you. Good evening. Nice to be at the meeting with the board. Glad you got some good grading down there. It's good for the farmers.
Yes.
And I think we've got Austin is showing the screen now, and that's good. I just got to exit out of full screen so I can still track my notes here. And I'll be on video at the end. You'll be watching the screen anyways, so won't need to look at me, or I don't need to be distracted by myself. We can get on with the presentation. So as it's indicated there, this is a review of Sunny Farms landfill presentation by Wind Solutions at last month's board meeting that I attended. Next slide. Again, my name is Chris Lund. I am a Senior Vice President with the GBB. We are a solid waste consulting company. We've been in business for 40 years. I have a degree from the University of Wisconsin. I'm from the Midwest. I'm from Wisconsin. And I've worked in private sector as a consultant and also as in regulatory for a state regulatory agency for 6 years. So with that, just a little background. The Health District Commissioner contracted us in the summer of 2019 and asked for some help in supporting their inspections and help address odor complaints at the Sunny Farms landfill facility. I visited the facility in the fall of 2019 and in consultation with the Health Commissioner, Beth at the time, staff, and the District Legal Counsel recommended several conditions to the facility's license renewal application. The license with conditions was passed by the board in December of 2019 and took effect immediately with timelines to have 2 new permanent gerometer locations installed and increase reporting to the health district so that it could be informed to a greater extent than had been provided in the consent order by Ohio EPA earlier in the year. It was indicated to me that that the health district was not included as sort of an equal party in terms of the decisions, the communications, and the reporting in the development of the consent decree, or the conditions of the consent decree. So since May 2020, we've provided a monthly summary report to the Health District Commissioner that provides a review of Sunny Farms landfill reporting provided to us through the Health District, and a statement as to the degree to which we believe that Sunny Farms landfill is complying with the reporting requirements of the consent order and the license. Next slide. So today, as I indicated earlier, I've been asked to provide my review and thoughts of the Wind Solutions presentation of Sunny Farms landfill presented to the board last month. My approach is to review, is to follow as near as possible the topics, the facts, the representations, the statements made by Sunny Farms Landfill, sort of a highlight of that. And of the facility presentation, offer my interpretation of what was presented to the board. So here's sort of an outline. They presented 19 slides. They sort of, I'm grouping in sort of 3 groups here. They had an overview of about 4 slides, and then they got into compliance performance with the consent order, five slides there, and then the remaining slides were on gas monitoring. And then I've just got a couple other items, and then I'll summarize. Next slide. So let's start with this. And this is what Sunny Farms Landfill or Wind Solutions started with. The current ownership bought the facility under consent order. There were comments or quotes, and that's why I have quotes around it. Landfills are a fact of life. There's 70 employees that generate funding. There's tens of millions of dollars of revenue that goes into the community. 15 parts per billion is a very strict standard, and a professional team. And I just wanted to hit some of these because these are some points I wanted to get at. The current ownership. I would not be overly sympathetic to the talk about the cost overruns of $35 million budget for the sulfur removal equipment needed to correct major Clean Air Act violations. This is about correcting past wrongs, and will only get that facility down to an emissions rate in 2023 that is finally all that could have been allowed in the first place. That's very important. They're getting you back, they're getting into compliance. They're not in compliance right now. They were likely able to buy that facility cheap because it had a terrible compliance record and terrible compliance problem, and they knew what they were getting into. So I mean, it's just, you know, they need to spend the money to get this thing in compliance. A comment about the landfill's effect of life. You know, a violating landfill of this size is not a fact of life. Landfilling is not a fact of life for urban and northeastern communities sending waste to this facility. They're getting out of landfills. They want a cleaner environment. They're finding other places where they can send this so they don't have it in their neighborhood. For this
Hey, Jim.
predominant, excuse me, should I continue? Okay. For this predominantly rural and agricultural community, a landfill that takes in about as much waste as generated by the local community is more of a fact of life. But to say that a landfill that takes in 7,500 tons and may take in as much as 12,000 tons a day is a rare exception. The tens of millions of dollars of revenue that goes into the community, there no proof was provided. I cannot speculate on the validity of that statement. The 15 parts per billion is a very strict standard, is a quote. The human sense of smell can detect odors well below 15 parts per billion is common knowledge. Most facilities I'm aware of believe that 1 complaint is too much and that appropriate protective measures to avoid complaints be implemented. The professional team, with the exception of Brian Ezek and Ben Nutter, to my knowledge, has all changed in the time that I began to support the district in the fall of 2019. GMs have come and gone, environmental compliance managers have been replaced. The lack of continuity can be an issue or a symptom of other issues. Next slide, please.
Can I add to that ownership has come and gone also many times.
Yeah. Correct. Compliance. Let's jump into the next set of slides that was presented about compliance and performance of the consent order. We agree they have complied with the consent order and the license reporting requirements that has occurred over the last 3 years, but they're still in corrective action and are a year out from being in compliance with the Clean Air Act PSD regulations. The emissions are still 20 times what would have ever been allowed if things had been done right to begin with. Until that is finished, they are emitting SO2 comparable to the last few uncontrolled coal-fired plants in the state. They self-report SO2 emissions that were the 6th largest in the state in 2020. 5,734 tons based on the latest available data that we have. The number of inspections of Sunny Farms landfill reported to that the health district performs do not quite jive. They have 152 as opposed to 82 inspections that information I got from the health district. Perhaps we could see their sheet and compare with the health district. It's possible that the Jerome meter samplings, which are just a sampling event, were counted as inspections. I'm just not sure. The Jerome meter locations, we modeled these and found that while these locations were approved by Ohio EPA, that does not relieve Sunny Farms landfill from exceedances that are continuing. While we sampled, where we sampled in 2020, and we did a gas sampling event in 2020, was based on our modeling over the surface of the landfill, not just the flare. And there were hot spots, areas of concentration of gas that do not coincide with these stationary monitors. The latest, so just wanted to make that point. Continued, and I quote, continued, they mentioned voluntary compliance with the 2020 license conditions carried over from the 2019 license condition requirements. I don't know of anything that's voluntary about those license conditions that the health district put out. That kind of language used in the presentation and the text appear to imply that Sunny Farms landfill no longer considers these license conditions to be in place or carried over, which was the intent of the health district and approved by the board. This implies a lack of understanding in my mind for the district's authority to protect the public health. The sulfur dioxide emissions have gone down at the facility, but the numbers are still over the arbitrary limits set by the agency. That's a quote. I'm surprised, just a little surprised that Sunny Farms landfill would characterize this as an arbitrary limit, questioning its validity while it continues to violate the Clean Air Act, PSD standards, and produces enough H2S to be compared with a power plant. Next slide. Let's talk about intermediate cover requirements. They mentioned 46 acres of intermediate cover has been put in place. That's a requirement of the consent order. This was not being performed prior to the consent order. The presenter stated that they are getting ready for final cover in 2 years. So what that means is that they'll let it sit with intermediate cover instead of placing final cover placement when they may be at the approved final waste elevation. So when you get to final waste elevations, put intermediate cover and you could go with final cover right away for better increased odor control. So I don't know why you'd want to lag with that if you're concerned about the public. Again, intermediate cover is just that, it's required. Sunny Farms is not doing anything over and above what's regulatorily required, but give the impression they are. The odor control blanket. The odor control blanket covers 18 acres, which is only about 12 to 14% of the total approved footprint of the active south unit. Presentation stated that it allows Sunny Farms landfill to collect all gases 100%. I'm wondering from this area of the landfill, and yet I don't know of a system out there that is designed to do that. There's no system that I know that designed to capture 100%. And can make that claim that all of the gases are collected in landfill. Additionally, there is an area that is not receiving, this area, this odor control blanket is not receiving surface emissions monitoring. That's when you walk across and do the monitoring as you go across the site. This area is not receiving that surface emissions monitoring. So I don't know how they can claim, the claim could be made about it collecting all of the gases if it's not being monitored. And that's a question I have. The stormwater, let's talk about stormwater for a second. The quote was stated claim that the water in the ponds meet drinking water quality standards.
Sorry.
That is an apparent misrepresentation, and you'd have to go back to the slide to look, but you could clearly see turbidity present in that pond. in order to be drinking water quality, there must be a turbidity reading of 0.3 NTU to 1 NTU. And just by looking at that water quality, I mean, if you know how ponds operate, they clean water as they go through the length of the pond, and they reach water quality. They're supposed to reach water quality at the outlet point. The baffles are put in place to knock down the sediment to get it out so that you could get turbidity out of the water before it's discharged. Again, this is a fairly, I think there's also another statement that, you know, when it rains, we collect samples nearly immediately for evaluation. This is fairly standard requirement practice for any landfill that is required to have a multi-sector general permit for industrial stormwater discharges such as a landfill. So that's just common. Next slide. So here's a shot. Again, we're talking about the monitoring, continued surface emissions monitoring. The presentation stated that this is another belt and suspenders approach. Belt and suspenders approach implies redundancy or excess, when in fact, the surface emissions monitoring has always been a fundamental compliance monitoring requirement, collecting thousands and thousands of data points over the whole landfill, was another quote. This implies that surface emissions monitoring is over and above, and it's not. This also states, states that the surface emissions monitoring is done every day. That may have been a misquote. I'm not, but this is not true. Normally the SEM is done twice per month. The 55 acres of seeding that they mentioned in the spring and the fall, the presenter stated that the picture is of the landfill. It is, however, the photo is of the north unit. If you've been out there, the north unit is north of Trunk Road or TR 108. This has been closed and grassed for at least 6 years under prior owner and operator. The 55 acres may refer primarily to portions of the south unit where Sunny Farms Landfill has had some moderate success in their vegetation plan. And so you look at that Google Earth image and you can see the 2 dots there that we have placed, the red and the blue. Those are about where these photographs to the left were taken. That's the north unit, and that's closed and that's done, and that's been grassed a long time. Next slide. Let's jump into gas monitoring. The H2S treatment plant. Again, something that should have been in place many years ago. I don't know where any sympathy is needed for cost overruns of this system. They knew what they were getting into. The gas control system, the gas control and collection system, the GCCS, is currently expanding. However, it's only to get to the bare minimum for compliance purposes. They are doing it because it's not just a desire to do good, but to comply and get into compliance eventually. They're not currently in compliance with the Clean Air Act PSD standards. We still have not seen a current as-built of the gas collection system to see if they corrected coverage deficiencies in older waste. We still have not seen or evaluated well depth and the availability of open perforations in the gas wells. That, you know, the more perforations, obviously, the more that you can collect gas. The last operational data we saw on the gas system indicated lots of wells were effectively offline because of poor gas quality, which normally means the wells are non-functioning, are in a non-functioning operating condition due to lack of maintenance. Another, although I'm not for sure, but that's usually the case. Additional odor management practices, again, yes, they have complied with the consent order, but just to address non-compliance and errors of predecessors until they get into compliance. The site monitoring, constant monitoring. A constant monitoring, because they are currently in non-compliance and because of the potential to significantly impact the community if there is a failure when you're bringing in 7,500 tons a day. And again, like I said, they're not currently in compliance with the Clean Air Act. So how long before Sunny Farms requests reduced monitoring after the CO is lifted? They could ask for that. Permanent drone meters continuous monitoring, odor complaint monitoring, stated they monitor, investigate, and check out every odor complaint they receive, robust and extremely effective, permanent gerometers, continuous monitoring. They never mentioned, they did mention the Ohio EPA locations, the 3 permanent meters, but they also didn't mention the other 2 that the health district required to be installed. I don't know why they did that, or think that they all are compliant locations and need to be compliant at all these locations, but only mentioned Ohio EPA. I thought that was interesting. Next slide. Daily self-monitoring. Sunny Farms landfill does perform daily monitoring. This is because they're still, again, not in complete compliance under the consent order and need to get there. It is a particular interest that Sunny Farms landfill, again, does not mention the gerometers that the health district license required, and mentioned that a few times that they were voluntary. Additionally, the presenter stated that Sunny Farms landfill wanted to keep the impact where they are right now, implying that somehow, since complaints are low, impacts are low. And that's not the case. The facility continues to take corrective action because they're not in compliance and impacting the community. Odor complaint monitoring, complaints do continue. In the presentation, no explanation was provided of the odor complaints where they followed up a root cause analysis. We've documented very few follow-ups from the reported data that we've received. It would be good to have that data to analyze some patterns or causes of these complaints and really track it down. I didn't see any presentation. I didn't see anything in the presentation that indicated why they have these complaints, and they shouldn't be happening. What's the issue? The SEM, the surface emissions monitoring, nearly 100% compliance, but how many areas have been skipped? We know at least at times they'd be skipping the north unit or the north end of the north unit or the odor control blanket. The record's getting better, but this is something that, again, should have been done several years ago. The presentation apparently misrepresented current efforts and said that they were scanning the entire surface of the waste, but they apparently are still skipping the erosion control blanket. You can see in this photo, there's no track across the green area. The green area is where the erosion control blanket is located. And there's no track of lines that shows the SEM monitoring in that area. It mentioned again that the SEM was a belt and suspenders, but it's not. This is something that is a fact of all landfill requirements for any operating landfill to do SEM, surface emissions monitoring across the site on a regular basis. There will be, I do want to mention, the cover system of landfills typically builds up methane eating microbes that convert methane to CO2 before it's emitted, but they don't eat H2S. So a surface emissions monitor's methane should not be used to justify or substantiate substandard operating practices of the gas collection system, which is to control the H2S. The applicable standards will still soon hold them to covering all the areas where the waste is in place for at least 2 years, except for limited areas where they're allowed to skip, such as the working face and haul roads and very steep slopes. They cannot skip the erosion control blanket, closed areas or capped areas. Next slide. This is just a quick slide of a client, a landfill that I work at, that the client brings in about 1,000 tons a day, 500 to 1,000 tons a day. Look how close the houses are. They can't afford to have a complaint. Their rule is no complaints. If we're doing something wrong, if we get one complaint, they put in, as soon as they get the final grade, they're putting over the final cover because they know how well it controls odors relative to intermediate cover. So they made the comment, no Ohio EPA NOVs since 2020, dramatic reduction in public complaints. Marvelous success, question mark. The facility has been under a succession of consent orders for 15 years. They are just now getting to normal performance and are still in corrective action. The facility continues to require visits and inspections to be accompanied by site personnel. So they're still watching us as we go, as far as keeping an eye on us when we do go out there. Next slide. Just some final things, other items. Notes about video coverage of the waste unloading at Sunny Farms landfill. I'm unclear that if there is something that's noticed in real time by the district sanitarian observing the video, if there's a protocol to stop unloading or set aside a load for further inspection. The actual observation of the video represents a significantly small overall coverage of the incoming waste material. And that's just because you just can't have someone sitting in front of a video, monitor all day long, watching and trying to pick up waste. It needs to be captured on the site. It needs to be captured before it's loaded into the gondola at the transfer stations that it comes from. Next slide. So let me just summarize. There's been a lot of taking credit for a large effort needed to correct non-compliance and errors of their predecessors, i.e. they're not going over and above industry standards. They're rather clawing their way back to compliance. They're still, again, a year out of correcting the Clean Air Act PSD violations. Emissions are still, again, 20%. I want to repeat this, 20 times what would have ever been allowed had things been done right to begin with. Again, this bears repeating. Until it's finished, they're emitting SO2 comparable to the last few uncontrolled coal-fired plants in the state. They self-report SO2 emissions were 6th largest in the state in 2020. When they achieve Clean Air Act PSD compliance in a year or so, that's great. But what about 40,000 tons of SO2 emissions over the last decade that were not allowed? The CO has not made any effort to correct the past harm. If the landfill had gone through the process originally, prior owners would have spent a lot of money to do things right and would not have emitted 40,000 tons and would have spent the $35 million 10 years ago. And the prices of the facility for the new owners probably would have been a lot different. And what about the economic benefit that this landfill derived by doing the wrong thing when other landfills did the right thing? So just some observations about where they're at now and where they need to get to. They're going the right direction. We've documented that, but that's the gist of my thoughts related to their presentation.
Very informative. I guess I'd like to be open for questions from the board.
Yes.
Okay, very good.
I guess what I'm hearing is there's been a lot of sulfur emitted. And my understanding is there's no way to take that back. Is that correct?
Yes.
It's in the air.
So are you suggesting some kind of punitive efforts to make them feel the pain and prevent them from doing that, from falling behind in the future?
Well, I think that's a bit out of my expertise. I'm not a lawyer, and how you make decisions related to that and their permitting. I'm just these are just the facts that are based on the past operating conditions and what has occurred.
Okay. I was looking through the report, and one thing that struck me, you were mentioning wells and gas wells and trying to make sure that they're working properly. You got to keep the liquids out of them so you can collect gas. Did I read correctly that some of the deepest wells will be 475 feet deep on the expansion, with the expansion? I thought I caught that number.
Well, I haven't seen the expansion documents. Those haven't been sent to me to take a look at, so I
Okay.
don't know.
I apologize. I didn't know that. Okay. But it seems to me, though, the big thing is with the expansion, you also mentioned verification of what the waste is with all the video. It's very tough, and with 7,500 tons now, and then going to 12,000, or maybe not quite at average, whatever, it's going to make it exponentially worse.
Yeah,
Difficult.
well, more difficult in my
Yeah.
opinion, my personal opinion. Yeah, I mean, there'd need to be a lot more controls in place, and safeguards, if you went down that route.
From another perspective, from the city of Fostoria's point of view too, there's a lot of cars that are staged just next to our town. They're in the township, they're outside of city limits, but they are sitting there full of trash for periods of time. And again, with an expansion, there's going to be even more cars. I'm wondering where they're all going to be staged, and that kind of an impact too. That's a big concern for me.
Yeah, and if the decision were to continue this, I mean, is that there's a lot of waste that is transported. MSW waste is completely enclosed in containers. They're not open top. Do they have to be open top?
Yeah. So classification of the waste again, with the quantities is a concern. Is there other questions from the board, other people? Right now, or consultant? I appreciate the input. This is very informative. We've been asked, how much testing we do, that type of thing, and what we test for. I think that the public is looking for additional testing. Especially if it's expanding, I don't know what else you would have to test a lot more, I believe. And what we test for is a concern too, because you read about so many different compounds and different things that could harm you, and that you want to be aware of it. So we're trying to protect everyone. So you've got to be on top of it. Very good.
Yes.
I think to agree to an expansion would be a catastrophically bad idea. This is a company that it's just one violation after the other. It's insanity. They've never did anything right from day one, and they keep on doing it and keep on pushing it. I was looking at the way they're supposed to dispose of certain types of waste, but the way they have the conditions on these, they can pretty much do anything. They can put it all together. They're supposed to manage like certain materials and separate them, but the way our permit is set up, they can put it all together, which creates all this gas. So I don't know. Anyway, I guess it's not really a question, it's a comment.
Well, we have agenda items further on in the meeting here for discussion about that type of thing too, just so you know.
Okay.
But we're just making sure that anyone that had questions for our expert, for Chris, got a chance here to ask about the landfill and that type of thing. So it's some things. Go ahead. Sorry.
Ed, I would like to say I'm sure the rest of the board members feel the same, but I appreciate very much his input, his perspective on that whole presentation.
Right.
Yeah, I have a question real quick for Chris. Chris, can you explain what piece of this you do and what you usually work with Trinity Consultants on? Because like we're only approved to deal with the solid waste side of things. We don't have any control over the air quality side of the permittings, the permits or the inspections, things like that. So can you talk a little bit about the differentiation between the solid waste piece and the air quality piece, or the air pollution piece?
Yeah, I mean, the regulations under which the landfill exists and operates are Ohio EPA has primacy. They are the primacy agency. These are their regulations. You are the health district. You have very limited ability or control over Ohio EPA's regs. It's Ohio EPA that regs that are being complied with here or not being complied with. With respect to the and that goes for solid waste or the air, but the air permit, the air regs, again, fall under the jurisdiction of Ohio EPA. And they have their permit processes. We have commented on those permit processes. We have provided comments about the permit to install the gas, the air permit, to really what our comments were to tighten things up. I mean, it just in our review of the permit, it didn't look like it was as tight as it could be. That was being proposed by Ohio EPA, and you know, I don't know if they were missed or overlooked, or but you know, those are some things that we worked to ratchet down in the comments that we provided to the health district to address that, because you're at that point. And if I may step back, I mean, we're in such a small part of this whole process about landfills and landfill development and, you know, waste management. I mean, this is just about the regulatory aspect of it. I mean, my experience in we're a company that you know, gets involved in projects from siting a new landfill to operational corrective actions, stuff like that. I mean, there are different places to get involved in you know, landfill and its operations. And what I have been asked to is to focus on the consent order and the compliance. There's obviously a complete universe around the whole operation of the landfill and in fitting in the community that I'm not involved with, or, you know, haven't, you know, commented on. I'm associated with the compliance with that consent decree and your license conditions. And that's what I've been tasked with. And that I'm trying to stick in that frame.
How is it that the Ohio EPA has just allowed them to violate the 20 times more than what the Clean Air Act says? I mean, they've given them a license to pollute, pretty much. Aren't they supposed to force this?
Well, yeah, I mean, one of our
I
concerns.
mean, that puts us in a real bad situation. It makes us look like the health department doesn't give a crap about our people in the community.
Well, you know, right. And should you be blamed for that? Or this is Ohio EPA's responsibility. Why aren't they doing their job in enforcing their regulations? For example, the consent decree was, oh, we gotta catch up. They're not doing what they should be doing. Let's get on them. Let's get this consent decree in place. But we'll let you take 3 years to put in this sulfur plant, you know, this $35 million sulfur plant. Well, 3 years is a normal time that you would give when someone is in compliance and they've now reached
now they want to expand.
Yeah, they've reached that threshold where they now have to have a control system in place, and they're allowed to put it in 3 years for a compliant landfill. Ohio EPA has allowed them 3 years, and they're already in violation. Why not get this thing in 12 months? Why are you giving them, you know, 3 years to do this? I
think they were supposed to have it done in 2016, if memory serves me right.
Right. Okay. Well, with that, I think that we may have some more discussion here longer in the meeting as we go down here. And before we do leave, though, one of the questions comes to my mind is there a reason we wouldn't want Chris to review the permit for expansion?
Yes, actually, I have sent it to him, but he probably hasn't gotten to it yet because it's like 6 different emails. It's so big. It's massive.
It's
So
1,500 pages.
Yeah, yeah, it's massive. So it will take time to review anyways, that's for sure.
You're
So,
right.
yeah.
I correct myself. You did send that to me. We just have to say, hey,
It's,
what do you want me to, you know? Okay.
it's a lot to get absorbed there, and I looked through it and with the drawings and all the documents, and they obviously included a lot of manufacturers certifications and test data and a lot of things that thicken it up. So I'm sure the information in there, but you have to go sort through it. So that's where I think I saw the depth of one of the depths on the well. And I was like, oh, wow, just giving you an idea of the size of the hill, I guess is what I was thinking. So,
Yeah.
okay.
Yeah, there
Right.
is so much information in those multiple documents. I mean, it's really not one single document. It is multiple drawings and multiple attachments, and
Yep.
it really gets down into the engineering kinds of stuff, which isn't what most people's expertise is.
True.
So,
Okay.
And I neglected to mention, you did mention Wes, and I don't see him, I guess, is he on?
yeah, he's on.
West is on.
Okay, Wes Younger, Trinity Consultants, they are the gas specialists that we work with, and that came out and did their air sampling. And Wes is really a guru when it comes to the air permit regulations in this field. So he is here. And Wes, I didn't know if you wanted to say anything, or if you felt that I said enough, or if there were other questions related to that.
I think I'll just add at this point,
Thanks, Wes.
there is the general, the primacy you mentioned of Ohio EPA and the air question. The older standards did work that way. They were primarily delegated to the states. The regulatory situation for all landfills is changing. And at this point, we've switched over to a different class of standards, hazardous air pollutant standards instead of new source performance standards. The state will still have delegation to implement that, but when interpretive questions come up in that universe, they're much more likely to go to US EPA. US EPA maintains a lot more ownership and control of those standards. So it'll be interesting to see how that goes now that they have acknowledged that they're over the thresholds, and they have been for a long time. They'll have to follow the standards more as they were written versus just the paraphrased version in the consent order. So it'll be interesting to see how that goes. I continue to be surprised that US EPA has not been involved in this case. Certainly, if the consent order hadn't been written, US EPA would be involved. I can say that much. And I am happy to see the new ownership taking things in the right direction. It does take some time to steer a big ship, but they started in a pretty bad place, frankly, when they took ownership. So there's a lot of catching up to do. And I do agree with the comments about taking the right amount of credit, right? If they do something really amazing, then we should give them big kudos, but for working to catch up with the law that was supposed to have been followed all along, at a certain point, they're risking tooting their horn a little too much. I guess that's my take.
Thanks, Wes. Ann?
I was just gonna say, I appreciate Wes and Chris being willing to jump on and provide feedback, sort of as a way of a cross-check. Because again, I'm certainly not a landfill expert. My previous health districts haven't even had landfills that they were responsible for. So that's the value of being able to bring in people like Chris and Wes, because they know this stuff in much greater depth than we possibly could, because they deal with it every single day in multiple places. And so I think it's always helpful to have people who have that exposure and expertise in multiple locations, because they can say, well, it isn't done this way elsewhere, or it is done this way everywhere else too. So I think that's always beneficial and helpful to us.
Mhm.
Could I ask, we mentioned about the new ownership, and as we talked, or as I mentioned earlier, there's been new ownership multiple times over the past 20 years, whatever it was. So the perception in the community is that it's not really new ownership. It's just a change of names, the legal entity. Every time something, they want to distance themselves and say, hey, look, we've got new ownership and we're going to fix things that the old company didn't. But that's perception. Now, what's your take on that?
My personal opinion, I mean, that is a very common approach in any business that when it comes to a landfill. It happens in many other locations in a very similar way. The people only see the continuity of that is one landfill. It doesn't matter who's operating it. It's still that landfill. There's, a new company isn't going to make any different if it's not operating properly.
I would add, Wind Waste, the current ownership, does have some credibility. They're more of a national player. This is not their only landfill. So I do suspect that at least while they continue to own it, things will be headed in the right direction. Who knows how long that will last? But that's generally my perception of who they are. Definitely better than where things were in 2019, 2020.
Mhm. And with the expansion too, you're wondering about if the system they're putting in, the gas treatment system, if it's even sized to handle the expansion. So there's really no guarantee. That seems like they're getting the capacity for the future. We don't know yet. It seems unusual to proceed without proof of concept on some things. And that's my
There's
engineer.
no guarantee you can handle the old stuff too, for what I've been led to understand.
They will need to go through PSD permitting to get the expansion. It's not just a solid waste permit. And as part of that, they'll probably have to build a second full set of sulfur treatment system. What a lot of people don't recognize about how the landfill industry works, if you think about them as a seller of a product, their inventory is space for which they have a permit that they have not filled. So if they can go through and get this expansion approved, they suddenly have 20 years of inventory on the shelf. That's an asset, and banks see that. So needing to spend on a second generation of the pollution control system, if it comes with that kind of asset, is not a problem. That's just the normal way we do it.
Okay. All right. Thank you. Is there any other big question, or because I think we should probably try to move along with the next item on our agenda, and we'll be bringing this discussion up a little bit, a couple items further on in the agenda to discuss further. So don't worry about that. We're not done with this. Okay. Hearing no other questioning, let's go on with the approval consent agenda that we've got, and that includes the April board meeting minutes. If anybody has any questions on the minutes from the last meeting, any discussion? Okay, don't hear anything there. Then we've got the WIC division report from Tricia. Okay, Kayla. Anything else there? I had one question about WIC, and it has to do with actually with the formula situation in the United States. How has that been handled by us? Have we been impacted by the formula shortage? Is WIC addressing some of that?
I'll answer until Trish can jump on.
Okay,
You know, that, yeah, it definitely has impacted us just like everywhere else. And they've been answering calls and assisting for a while. I'll let Trish take over. I see she's now unmuted.
good.
Can you hear me?
Yes, we can.
Yes.
Okay. We have, yes, been impacted. I've been trying to monitor it myself as to know what is available at the grocery stores so I can let our participants know if there is something that we are able to provide them with. Unfortunately, there is oftentimes not. I know the federal government and the news is, you know, posting stories that they will be able to get anything with their WIC benefits, but it's just not that simple. We have not received any notifications from the state on how that will be handled yet. Everything that we do is loaded to a chip card, and it's all based on a UPC. So really their card is loaded for one UPC, and how that would work to expand benefits, I'm not sure. How it could take a long time, and unfortunately the problem is right now. Some of our doctors' offices have a small stock of formula that they are helping our participants with if they are able to, and we have changed types, kinds to what is available. But it is a problem. There's really not a lot of good answers, and it's awful.
Thank you. I was afraid that might be the case, but I don't know. I was hoping somehow we had a local supply. I don't know why, but anyways, whatever. Thank you. The next item is the nursing division report. I didn't know if there was any questions about that or if Andrea had comments or anything. Okay. And then the environmental division report was on here too. And I noticed that we don't really have any action on the condemnation or rescind condemnations, anything like that going on right now. Just the announcement about the general update of the June 8th meeting concerning the landfill expansion. And we're trying to get that message out to the public, everybody. So make sure everyone can tell that's going on. And then last, it was the health commissioner's activity report by Ann. Anyone have any questions on that for her? Okay, given that, I was wondering if I could get a motion to approve the consent agenda as we were just discussed.
Also move.
Second.
All right, thank you. Let's take the roll call, please.
Mrs. Boroff? I'm sorry, Mrs. Boroff, I think you're muted.
Oh, yeah, you may. There you go. Still muted. Thumbs up or down? Oh, there you go. There you go.
Yes.
Mr.
Okay.
Logston?
Yes.
Mr. Steyer?
Yes.
Mr. Watson?
Yes.
And Dr. Wolf?
Yes.
Thank you. Thank you. Next agenda items are the discussion items are the health commissioner's report by Ann. So I'll let Ann
Sure.
take that
So
away.
I had just a couple things I wanted to highlight. And I'm going to share my screen for this. Every year, the Population Health Institute and the Robert Wood Johnson Foundation put out the county health rankings. And so I just wanted to briefly review those. And so let's see here, we can pull them up and share the screen. So are you able to see the county health rankings for Ohio 2022?
Yes.
On your screen? Okay. So
Yeah.
they have for each county listed, so you can look up any county you want. So I've pulled up Seneca County, obviously. And there's two overall rankings that are used for every single county, looking at the health outcomes and then looking at the health factors. And so you can see how we rank in comparison to all the other counties in Ohio. So as far as health outcomes, we're between that 25th to 50th percentile out of the 88 counties. And in the health factors, we're between the 50th and the 75th percentile. So you can see they're ranked from least healthy to healthier. So we certainly have room for improvement. And then the report then goes through the various different factors that are taken into account for both of these rankings. And it does rankings individually for each one of these factors. So within health outcomes, the kinds of things that they're looking at are what's the length of life, or what, how many years of life are lost due to premature death. And then what are other factors related to the quality of life? So you can see here, poor, or for what's the percentage of residents that are reporting that they have fair or poor health a certain number of days a month, or poor or fair mental health, are just two of the examples. Low birth weight is also in there. And then there's a whole variety of health factors that are in here as well. So what I'm going to do is show the areas to explore, where we have the greatest area for improvement, and then also where our areas of strength. So the areas to explore where we score lower is it will have brown around them, and the areas of strength are in purple. So two that you can see automatically here is that the areas of adult smoking and adult obesity are places where we could improve, and that would improve health outcomes ultimately in our county as well. If we look at clinical care, certainly one of our areas of strength compared to the rest of the state is that our percentage of residents, adults that don't have health insurance, is about 7%, and compare that to the state at 8%. But then right below that is our ratio of people, residents to primary care physicians. That is not very good compared to the rest of the state. Even though it might seem like we have lots of primary care, we don't in comparison to other counties or other parts of Ohio. So, you know, we basically have more than twice as many residents per provider, which means there's residents that either don't have a primary care provider, or the primary care providers are overwhelmed with the number of people that need to seek care from them. Other areas, it's surprising that the very next line, dentist, isn't also highlighted, because you'll see there, it's a very similar ratio of, you know, the rest of Ohio as a whole has 1,500 or so patients per dentist. Here it's basically 2,400 residents per dentist. So what's nice about this, you can pull up individual counties as well. So you can compare and see, okay, well, how do we compare to Sandusky and Hancock and Wyandotte and Huron? So it allows you to get a feel for not just yourself, but yourself in the context of your region or your neighbors too. If we look at socio and economic factors, which play a really large impact on a person's ability to have the best health possible, we have several things that are in our favor. We have a relatively high graduation rate, and we don't have, our income inequality is not as drastic as it is in other parts of the state. But our unemployment is equal to the state's. So that's an area for improvement, clearly. So there are additional factors that are within here, but this is something that anybody can take a look at. And there's a whole lot of information in here that can be explored, but I just wanted to show it overall. And if we look at the health outcomes overall, if we look at the entire state, it's nice because you have this map that makes it easier. So you can see that the areas that are darkest green are the ones that rank the poorest, whereas the areas that are in the very lightest green or white actually are the areas where they have the best health outcomes. And similarly, we can do the same thing with health factors. So all those different things that contribute to health. So if we look at the overall rank, again, the darkest counties are doing the poorest. The lightest counties are the ones that are doing the best. And you can see in both, we're not at the dark end, we're not the light or the dark end, we're in that middle grouping. So you can see overall, yes, there's certain counties where they tend to be areas that are more economically disadvantaged, tend to have poorer ratios of healthcare providers to residents, lower graduation rates, but there's certainly area for improvement for every single county. And your goal is to improve from where you are, not necessarily move up in the rankings overall, because if everybody's improving, that's still leading to better health for Ohioans. But certainly in comparison to where you are, over time, you want to improve over time. So I just wanted to give you some exposure to that. You can see where you can find that is the countyhealthrankings.org. So I encourage you, if you have an interest in this area, to take a look at it and dig into it a little bit more if you'd like. So that was the primary item that I wanted to share today with you.
All right, thank you, Ann. Appreciate it. Next on agenda item is the Sunny Farms landfill permit to install application to expand. So we all had probably in our minds want to discuss that further after hearing what Chris Lund presented, what we heard, and from gentleman from Trinity. Apologize, don't remember the name, but anyways, it's good information. And so we've got the expansion permit. And so as far as what the status of what's up here, I thought we'd have a discussion, see what our thoughts are as a board.
Yeah, and I'll kick it off by explaining what we've done thus far to, it's not specifically a role we're required to play. In the expansion, in the permit application process, there's multiple steps that are all dictated by the EPA, because the permitting process is owned by the Ohio EPA, whether that's for a solid waste facility or for an air quality or an air pollution permit. And they actually have both of those pending right now. So the first step in the process, especially for like an expansion, is that they file the application, and then they're required to hold a public meeting. So the public meeting that happens on June the 8th here in Tiffin at the Camden Falls facility is something that Sunny Farms is required to host. It's their opportunity to present to the public what it is that they put in their proposal, to answer questions. And the EPA participates in that by explaining the permitting process. So, pointing out where the public has opportunities to give input and make public comments. The one thing that's really unknown about this entire thing is the timeline. There are specific parts of the process that have specific timeframes, but they're only the public comment periods that basically have time limits. Everything else, the time frame is determined by the Ohio EPA. So if they find that it takes them 6 months to review an application, they're allowed to take as long as they want and need to do that. They can then go back to the applicant and ask for additional information or ask for modifications. So it's really hard to predict how long this process will actually take. It could take 6 months, but it could also take several years. It really is Ohio EPA's, they're the ones who drive that time frame. So that was one piece, and we've provided a graphic of that process previously. Our citizen advisory group helped us, finalize how that looked, and so that's been posted to Facebook and put on our website and other places. Once the application was actually submitted, we did make notices available on our website, and we posted the entire application on the website, as well as making people aware of it through Facebook. But the primary notification falls on Sunny Farms. And basically, they're only required to do a legal notice that goes in the newspaper. So they've done that. They've done it actually in more newspapers than they're required to. They did it in both the Advertiser Tribune, and I can't think of the name of the newspaper in Attica. They did it there, as well as in the Review Times in the Fostoria area. So they've done that, but we know lots of people don't read the newspaper. Lots of people don't get the newspaper anymore. And most of us don't read legal notices. It's not like they're enjoyable, engaging reading. So we initially started with a letter and maps that we were going to mail out. Due to the time frame of how long it takes to get out a mass mailing to, and Austin can jump in here with the right number. I'm thinking it was like 19,000 households. It's a challenging process to go through that whole thing of bulk mailing permits and all that. So we shortened that down to a trifold brochure. But even so, with the time frame, found that we couldn't get that out and be sure that it would get to people. So we've ended up taking a multi-pronged approach. We have a postcard that we're sending out to folks with a map basically showing what's the size of the units currently and what's the proposed expansion size, and then some basic information that then directs them to our website so they can actually see the whole application if they want to look at that. But especially encouraging them that there's a public meeting on June the 8th at 6 o'clock. Go if you have any concerns or interests, if you want to know what's being proposed. And so we're also doing some newspaper ads. And I believe this is an Austin question. I think we were talking about maybe some radio ads as well. So that we try to reach people via different methods. None of those are things that we're required to do, but we want to make sure that people do know about it so that they know they have this opportunity to hear directly from Sunny Farms. So that'll sort of kick it off to let you know what it is that we've done thus far.
Okay. Thank you. With that, then basically we've got a situation where we've got the expansion being proposed. And we're in a position as a board where asking legal counsel, we're in a neutral spot because we are approved by the Ohio EPA to monitor the landfill. And so we have a neutral position in the sense of, yes, the expansion is going to require more work. It's going to require more testing. It's going to require us to be even more vigilant. But as far as any other opinions, we're the ones who are tasked with trying to make sure they're compliant and keeping people safe. Having any other opinion, it's in a position where it's unethical to have a position because we're in a neutral spot where we're tasked to do one thing and we're approved by the entity. So we did get legal counsel sent us an opinion about this. I struggle with this in my mind, went around and around about it in my head, but it really is going to come down to eventually in the long run where we would be asked to vote on their license again, like we did last year. And I remember in the last time the voting at the board, there was several yes under duress. It doesn't matter. It's going to come down to now we either say yes or you actually have to stand up. I mean, it would have to be a position where we're telling the EPA we're unwilling. And then we're facing the fact that they would say, well, then now you no longer have the right to monitor or watch them.
Okay, I got to have a comment about this. I'm sorry. But the fact that the Ohio EPA is allowing them to basically pollute at 20 times the rate of what they're allowed, and they're putting the risk of our people, they're putting the health of our constituents at risk. I have absolutely no problem saying, no, I would never agree to that until they can fix the present problem that they have. It's not a very hard position.
I understand, and I observed, I wasn't on the board at the time, but I did observe the health department not approving their license at one point. And
they can fix the problem and get it with where it is supposed to be, then then yeah, then I can see where you could say, well, you can't you can't not do that because you could be sued. It's like, well, I'm sorry, you guys haven't been compliant. You've been polluting at 20 times the rate that you're allowed. So what, we're going to reward you because you have good intentions of putting in this containment system that may or may not work.
If I can
So-
jump in, one of the challenges with that is that the license is for the solid waste, operation of the
Oh, I
solid
know.
waste. So
I know, but
so
our mission statement is for the health
yeah.
of our people.
Well, I understand what you're saying. I'm just saying
Yeah.
that we don't have control over the air. We don't have any control over the air. We don't inspect for that. We're not authorized to inspect for that. It's not part of what we're approved for, I guess.
I know that, but for us to say, okay, we're going to approve a permit to let somebody pollute, but it's going to pollute a different way that we're not in control of. That's insanity. I'm sorry. It's like, okay, then we should sue the Ohio EPA for not doing their job. Why can't we bring in the federal EPA?
I'm not a lawyer, so I can't speak to their involvement. To me, it would be the federal EPA would have to be the ones talking to the Ohio EPA. I mean, I don't know what the reasons for that would be. I mean,
Right.
somebody
I'm just
has-
saying
yeah.
they can't expect us to do something that isn't something I don't immoral, in my opinion, to go in and approve that they can go and pollute from something that we have no control or say of. I'm sorry. I can easily sleep well at night saying, no, I won't allow an expansion until they can fix the problems that they have.
I don't know if we're being asked about that, about
Right.
whether we would approve it or not. I mean, I don't think they are. I think we're in a position of like, they want us to do what you are the health department. You're approved to monitor these guys and issue the license as you're supposed to by the Ohio code, and that's about it. And
Yeah, we actually have
yeah.
no say in the permit, whether it's
Yeah.
approved or not approved.
Yeah, and if we try to resist, as you mentioned, I don't know, I'm not so much concerned, I guess I shouldn't say that, but the legal aspects aren't the biggest concern, is the fact that you're now removed from any rights to do any kind of regular monitoring or watching them at all. That's the concern I have.
It doesn't seem that our monitoring and watching them is being any of a bit of a deterrent, is it?
Good point.
I mean, really.
Yeah, but it would be a big decision for us to say we're unwilling.
Well, I can't go and say, okay, go ahead, let's bring in more, let's double the tonnage and increase the gas output. But we don't have any say in that because we can't, either way. Continue. I'm sorry. Let's get it moving.
Well, no, no problem. I want that input and I want that discussion. I'm trying to get a sense of, I want everyone to understand what I think I understand about the situation we're in the middle of. And so
Right.
the board has that kind of a decision in front of them. So right now they got the meeting coming up for public comments. Whether or not they approve expansion and when that all happens and everything, like we mentioned, we don't know for sure the dates. I also
Okay.
don't like the idea that they've been able to produce excessive amounts of SO2 special dispensation. So I can't explain why that's being allowed, because that's the decision made by others too. Now, as
Right.
far as the water and the testing and everything, so we're looking at that and had that be a good discussion. So we're trying to think about the part that we are approved to do is testing and that type of thing for the water, groundwater. So
We need to do that with our own people, not the landfills people.
okay.
Somebody a neutral third party.
And Laura can probably better address that, what we do versus what they do. It's actually two
Correct.
different types of sampling. We're not sampling the same water even, so.
Mhm.
But I think in the middle is a great way of describing it, because, yeah, we're sort of in the middle with very limited powers. The assumption, I think the assumption that we have lots of powers, but the reality is we have limited, and therefore you as the board get put in this position of, do something in areas that you aren't authorized to do something about, and yet having no say in what EPA's decisions are related to the permit. Certainly the question of Ohio EPA and US EPA is certainly something we could take back to our legal counsel. They specialize in environmental health law. It certainly could be a question that I send back to them and say, can you explain how this works or could work or should work? Or because I really don't know what inspires or prohibits, or when the US EPA ever decides to get involved in things. I don't know that piece at all.
Could we ask the lawyers to look into the requirements as far as, like in the previous expansion, there were public meetings, of course, held by the EPA. And, a number of us went there and talked. We each had a few minutes. And I know that I urged the EPA to not give a permit to expand until Sunny Farms could show 1 year without any odor complaints. And that was because of, the atmospheric conditions during the different seasons. You see the odor complaints rise and fall with the different seasons. So when they fall during the summertime, then everybody thinks, okay, everything's good. We're good here. Well, EPA chose to disregard all of those comments and just give the permit. So is there any legal way for them to, or requirement for them to consider that? Like Mr. Wolf was talking, they haven't shown a track record of compliance. Why should they get a permit? Is there some legal standing there? Is there any way to ask our legal counsel about that?
Sure. I mean, there's no reason we couldn't ask.
I think we should. Yeah, Phil, so we did get that. We did request an opinion about what we already stated, our position. The attorney came back and then I thought I knew ethics. I've been going around my head trying to understand this, but you're basically being put in a position in the middle of don't say anything, but do this thing to monitor. And if you don't, you can't monitor anymore. So.
And I do happen to believe with all the things that Clay has said, and Phil, of course, too, but we need to assume and recruit the information that's given on the June 8th meeting. The questions, the answers, the non-answers, that's an informational status that we need to absorb that kind of information.
Okay. I agree.
I know we certainly have several folks from here that are planning to attend. I know I've spoken to, not directly to commissioners, but to some of their representatives as far as encouraging them to attend, because it's always best to hear it firsthand. What is it that they say they're going to do? Yeah, that's always valuable.
We got Wes Younger from Trinity. This guy's raised his hand here. He'd like to speak. There's a comment. Go ahead, Wes, please.
I can jump in and shortcut a little bit, needing to wait for the attorney's opinion. I can't speak much about solid waste permitting, but I live the air permitting. So the way that this will work, I know, of course, it's separate permitting processes for the expansion. There'll be one for solid waste and a completely independent one for air. The air permitting project will be a PSD permitting project, potentially per PSD avoidance. It will be a public process. And there will be notice and comment. So similar to what we've done before, when they've, for example, published draft permits, we're free to express opinions as individuals, as health department. You don't need any special authority, right? There's 3 enforcement authorities under the Clean Air Act. It's the delegated state, US EPA, and any interested citizen. So I can't really weigh in on Ohio law and how the agencies interact, but that's what's there in the Clean Air Act, and that's everywhere.
Okay.
So I'm sure Chris and I can help, provide some ammunition for that process and make sure that whatever comments the department may want to provide kind of hit the target technically.
That would help.
Yeah, and so they do have a draft Title V permit right now, Wes, but that does not appear to be related to the expansion.
Correct.
Because it was actually approved, the draft was prior to the application for the expansion.
They have to renew their Title V permit every 5 years.
Yes.
Or at least file to.
Yeah, and this one incorporates the gas collection system that they're in the process of building and
Yes.
combines it with their other existing permits. And they are doing a virtual hearing on that. We requested them to do a hearing and they did grant that request. They're doing that as a virtual one. And that's going to be later in June, I think either June 26th or June 27th. So that information I've not seen put out yet publicly, though it should be coming soon because they're within that 30-day window here pretty soon. So, but yes, so I think you're describing another step beyond. That'll be another permit then beyond that Title V permit.
Yes, the
Yeah.
Title V permit is an operating permit that just
Yeah.
governs how you operate sort of routinely, as
Right.
opposed to changing things and expanding things.
Yeah.
That citizen enforcement authority does also have a mechanism rarely used where a citizen, which normally is an environmental group but doesn't have to be, can petition US EPA to object to the state issuing a permit for construction or expansion on the air side.
Mm.
So there are mechanisms, and they're not necessarily dependent on agency authority, although the agency credibility could be useful in that context.
It's good to know. Okay, well, we'll have to follow up on that, definitely. Okay. So it looks to me that we have to do some little bit of homework here in order to figure out what technically, as a public at the meeting, I'm a person like anybody else, I guess. You're allowed to comment, and that's what the EPA has to listen to. It's public comment, period. So if there's some way that we as a department can comment and ask those questions, we will investigate that for sure with Wes. So thank you.
As a note of correction, Laura said that the notice about the virtual hearing for the draft 5 permit has been published in the paper.
Okay. Got it. That's later in June though, compared to the meeting, the expansion meeting. Okay, thank you. Okay, the next item on our agenda is personnel actions. And the first item was the out of county state travel. And I see a request here for, looks like if I'm reading the right piece, it's for the estimated expense of $1,000 for various public meetings and travel. And it's just a blanket request here. Could I get a motion to approve that?
Also move.
This is Bob. I'll second.
All right, thank you. Take a roll call, please.
Mrs. Boroff,
Yes.
Mr. Logston,
Yes.
Mr. Steyer,
Yes.
Mr. Watson,
Yes.
and Dr. Wolf.
Yes.
Thank you. Next items on personnel actions, we have a couple of resolutions. First one is the resolution 2022.11. And it's whereas in order to comply with the set policy dated May 25th, 2006, the board reaffirms by resolution the hiring of the following employee: be Anna Klauka, Public Health Nutritionist 2, WIC Division, and it's effective May 23rd at 2022. Okay. And the second resolution, put these together and I think we can vote them on, both of them.
Right.
Is whereas in order to comply with the set policy dated May 25th, 2006, the board reaffirms by resolution the hiring of the following employee: Nicole Mitchell, Environmental Health Clerk 1, effective May 23, 2022. Okay. Got to get a motion to approve those resolutions.
I'll make the motion. It's Bonnie.
Thank you, Bonnie.
This is Bob. I'll second that.
Thank you. Take a roll call, please.
Mrs. Morris,
Yes.
Mr. Logston,
Yes.
Mr. Steyer,
Yes.
Mr. Watson,
Yes.
and Dr. Wolf.
Yes.
Thank you. Thank you. Agenda item D, we got policy actions. We recently had a committee get together, a subcommittee, look at the the Board of Health bylaws concerning when the dates are effective, when a person is signed to the board, that type of thing, to clarify that. And there was a couple of revisions we went through and edits, and we think we came up with a final as far as the bylaw change that would make it clearer as to when someone starts or stops their position. And it also has to do with the district area committee, because they don't meet. They meet once a year, I believe. And so we, as a health board, if we have openings, we have to figure out how can we fill those positions. So these are the edits, I think, Ann, if you have those, I can bring those up. But it's a
Sure, let me see.
bylaw revision.
See, yeah, and they were all sent to you all on Tuesday as well.
Yeah.
Because they met on Monday morning. So let me see here. I don't know that I have it pulled up, so let me.
Maybe.
I do have, this is Bob. I do have a question on this membership, Article 3 membership.
Yeah.
You talk about having 2 members appointed from by the mayor of City of Fostoria with approval of Fostoria City Council, and 2 members shall be appointed by the mayor of City of Tiffin with the approval of the Tiffin City Council. And 5 members shall be appointed by the District Advisory Council, and appointments shall be made due in due regard to equal representations of all parts of the health district. What define equal representation?
Well,
There's this too vague, and I think it needs to be, I think I'm going to table this thing and make you do some more work on it.
well, that you can do that. This is the wording that is in Ohio Revised Code.
Well, where does it say anything about mandatory having a medical doctor on?
That is not shown in this section, I believe.
Another
Just a moment.
section, I believe.
It's in the next paragraph. Let's see. That's where it was anyways. Let's see. It is somewhere.
What is equal? That's my question.
Yeah,
Well,
revised code does not define that. Now, certainly some health districts in the contract that exists between the district advisory council and the city councils, in the case of combined, that often spells out what, at least for the cities, but sometimes it's even what townships, so unfortunately ours doesn't get any more specific than 2 from the city of Fostoria, 2 from the city of Tiffin, and 5 from the district advisory council. And that provision around geographic or equal representation falls on the district advisory council, because it's the one that has the ability to appoint from anywhere in the county. So
So in theory, they could be all from Tiffin.
If they did it that way, yeah, I mean,
Yeah,
they're not doing what they should do according to revised code, but if that's what they made their appointments as, they could do that, yeah.
Well, in that regard, then I can't approve it.
So I
They
think
can't be
we,
specific.
yeah, I mean,
It'll be a no from me.
I think we would have to go back to the district advisory council and force them to
You-
say specifically how they're going to ensure there's equal representation,
Right.
or ask them to
Oh,
define,
dear.
yeah,
Define
consider
it.
it equal.
or ask them to define that.
I mean, ideally, you'd like to have a person from each one of the townships.
Well, that's not.
Yeah, I don't know, I go that far.
I know, but I'm saying, I don't know how that happens, but I'm just suggesting, you're trying to get everybody involved.
Yeah, I mean, I can tell you, in one of my previous health districts, basically, when we would put out a notice that we had a vacancy, we basically grouped townships and said, okay, we need an appointment from township A, B, or C. They have to reside in one of those townships.
That's a specific, that's a
Yeah.
geographic.
Yeah, that was how
Location.
we did it. And so, and we went as far as to say, okay, because the city got their own appointments, yeah, that city is in such and such a township, but the city has its own appointments. So the resident cannot live in the city, even if it's in one of those townships. They have to
Right.
live outside the city limits in that township.
I like
So,
that kind of language.
Yeah,
How many townships do we have?
It's more equal
50.
representation when it's outside the two for the city of each city.
Yeah, they need
When
to
it's
be
outside,
yeah,
too.
yeah.
It's just too big.
that's better representation.
Yeah, I mean, I can certainly have a conversation with the president of the DAC and see if they would be open to updating their bylaws to specifically provide that. And say that if they are not willing to do that, the Board of Health
What
is
it-
willing
what
to
is-
do
what
it
is-
in our bylaws.
What is the intent to have it from cities and then to have equal representation from all the health districts?
Yeah, from all the rest of the health district, yeah,
It doesn't say that, I don't believe.
right. Right, yeah, no, the wording, the way it's worded is
All
probably
parts of the health
exactly how it's in the revised
It
code,
doesn't really say that.
yeah.
No, I think your clarification would make sense too. So if we can make that much more defined rather than being just open-ended like that. So.
Mhm.
I had a-
Those people who are being represented outside the city of Tiffin and the city of Fostoria could report to their township trustees if there was a particular board situation or health situation that was a concern. Because township trustees often don't know
Right,
about the whole area of health, health
Right.
insurance and health control.
Right. I agree.
Well, while you're changing for that, we look at section 1 under Article 4. It spells out that the meeting shall be held on the 4th Thursday of each month, but it doesn't say anything about November and December being the 3rd Thursday.
yeah, we didn't touch any other part of the bylaws than just the membership.
Membership is what we were looking,
That was
yeah,
all we looked at.
yeah, but
There are other corrections that are needed elsewhere.
good to
Oh,
know
well.
though.
But you do publish at the first part of each year, you publish a schedule. These
Mhm.
are the board meetings. This is when we meet, dot, 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 dot.
Right, I
And-
mean,
yeah.
and
You
it
can
does
put
sort
in
of
your folder
address,
and keep.
yeah, it does say if the meeting day is a holiday or there is not a quorum, the meeting can be held at the discretion of the president. I mean, you can add language in there, shall meet,
Yeah,
the 4th Thursday, unless the group decides otherwise. I mean, that's common language. But yeah, we were charged with just tackling the membership piece of it.
Okay, I wasn't sure if you were looking for any other changes while you were doing this.
Well,
I was told no.
she asked me to take on more and I knew that there'd be already questions about the piece we were doing, so I figured we might address that and try to get it defined as far as the membership, since we have spaces that need to be addressed or filled as far as the board. So, yeah. Okay, but the comments are good. I agree. So
And-
we'll have to go back to committee.
And when this is all done, if we have a permanent file, which we can put in our folder and keep, you'll know how to refer to it.
That'd be good. Yep. Yep. I agree. Okay.
Good, thank you.
Looks like the next agenda item is financial tracks, transactions and paying of bills. Let me see here if I get down this correctly here. Advances, repayments, transfers. Okay. Reading the document I've got here for the fiscal notes. Looks like our top expenditures were vaccines were $14,182.19. The Fostoria building lease for May 2022 was $1,915.25. Cost for phone, internet, email costs for April, May, $780.23. And then some travel training, April 22 for nursing was $241.62. The health commissioner, $327.80. Health education, $405.60. And environmental health, $1,425.84. Our consultants, Gershom, Brickner, and Bratton, environmental health consultants, for their landfill consulting services in March 2022. We paid $5,522.72. Eastman and Smith attorney services for December 2021, $1,350. Copier maintenance lease, postage meter lease for April, $725.24. And the last item here, I'm showing some contracts for soil evaluations and systems, costs like that, are those to be approved later as a contract, part of the contracts?
No, actually, these are all
Expense.
expenses. So
Expenses,
so this is just pointing out some of the expenses, but the pages that all say voucher approval form on them, that's
Yeah.
actually all the bills you're being asked to approve.
I got you.
He's just pointing out what are the biggest ones.
The biggest is, yeah.
Yeah.
So the last one was HSTS contracts, the forced soil evaluation and systems designs. $2,220, $2,620, and two at $2,420 for a total for all of $9,680. On that one, I guess I would have to ask for soil evaluation and system designs. What is that related to?
So for them to be able to put in their household sewage treatment system, they have to have a soil evaluation done.
Okay,
They have to have a system design completed. So this is simply the approval of the expenditures for those services to be done. For these are all being done under our household sewage treatment system grant.
okay, very good. Those were the top expenditures for the May, I mean right here, what we had in the past here. So I think we already had the blanket PO. We already discussed and approved the blanket PO for the public health nursing travel for $1,000. We did that. Next item was the cash advance from the general fund to the senior clinic for $2,000 to cover fund until contract payments are received. That one sounds like that I should ask for a motion to approve on that one.
Yeah, so Ed, can I stop you for just a minute?
Sure, please.
If you go back to the agenda, she actually has these listed as separate items.
Let me see where, okay, I
So
apologize. I
like the
got
bill
that.
is
Yeah.
one, so you'd want to approve the bills and then the approval of the cash advances and paybacks. She just happens to put them all on one summary sheet to make it easy for you.
Ah, okay,
But-
got it.
but
So
they
the
are
top
all
items,
separate
all those
actions.
bills, okay.
Yeah.
So I listed off all those bills, top expenditures. So on that one, I guess I would ask, Can I get a motion to approve those expenditures?
I also move.
This is Bob. I'll second that.
Thank you. Please take a roll call.
Mrs. Boroff? Bonnie, you're muted.
Thumbs up or down?
Yes, 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 yes.
Okay. Mr. Logston,
Yes,
Mr. Steyer,
Yes.
Mr. Watson,
Yes,
and Dr. Wolf.
Yes,
thank you. Thank you. Okay, the next item then is the approval of the cash advances and paybacks. So right there, I'm looking for the, I got senior. Okay, that's this one right down here then. Got it. Cash advance from the general fund to the senior clinic fund for $2,000 to cover fund until the contract payments are received. Okay. That was one of them. There's another one related to equipment, salaries, and software. I think we should make a motion on the transfer of the senior clinic fund first. Can I get a motion to approve that, please?
I forgot to print that.
I also move.
Get a second, please. This is for the $2,000 amount that's being moved from the general fund to the senior clinic.
I'll second. Bonnie,
Thank you. Take a roll, please.
Mrs. Boroff,
yes.
Mr. Logston,
Yes,
Mr. Steyer,
Yes.
Mr. Watson,
yes,
and Dr. Wolf.
yes,
good. Next item is the approval of appropriations and adjustments. On that one, let me see, appropriations adjustments. Okay. We got 2 appropriation transfers to increase the software line for the purchase of updated Microsoft Office for the new computers were purchased with the COVID grant funds. So that's Fund 164, and the amounts are $500 from Fund 164, and from Fund 089, the amount of $900. So that's one transfer appropriation. The next one is appropriation to transfer to computer equipment to cover purchase of a laptop for a health educator in the integrated naloxone program. So it's from Fund 7096 for the amount of $1,500. And last appropriation is transfer to increase the software line for the purchase of updated Microsoft Office for the new laptop purchase for the health educator. So put some software on there. So in the integrated naloxone program, so Fund 7096, $500. So new computer software for the educator. Can I get a motion to approve those appropriations?
Ed?
Yeah.
There are 2 on the back of that page too.
Oh,
Sorry.
keep reading. Sorry, I missed them. Just keep reading. Thank you. Next one is a transfer for the advertising line for the additional funding necessary to cover the cost of billboards for the COVID-19 vaccination program. That's Fund 145, and that was $1,800. And the last appropriation is a transfer of $2,000 to cover the cost of the annual audit, and that's from Fund 060. Okay, I think. Let me see, is there anything else, or those are the appropriation adjustments? And there's some other supplemental appropriations, but we'll do those separately. So can I get a motion to approve those appropriation adjustments in the funds?
this is Bob. Also move.
I'll second that. It's Phil.
Thank you. Take a roll call, please.
Boroff,
Yes.
Mr. Logston,
Yes,
Mr. Steyer,
Yes.
Mr. Watson,
Yes,
Dr. Wolf.
yes,
very good. Thank you. Next one is a supplemental appropriations. This is from Fund 7089. It's the construction and demolition debris. And it's for the amount of $172,923.95. And that's for higher than anticipated appropriations needed to cover the CD&D expenditures. So it's the amount of money we're putting in and using related to Sunny Farms. Is that correct? Please let me know. Yes, it is. Okay. The next fund is 7092. Get Vaccinated Ohio, and it's for $37,000. We're putting appropriations in place for the fiscal year 23 Get Vaccinated Ohio grant, which begins 7/1/2022. So coming up this year, we'll begin that Get Vaccination Ohio grant. So thank you. So can I get a motion to approve those supplemental appropriations?
I'd like to ask a question about the first one. It was always my understanding that we were passed through on these C&D fees, and that we were paid by landfill, and then Anita doled out the state's share and the township and the county. So if that's true, then why wasn't there enough there to pay the state?
Well, actually, I think maybe I worded that a little incorrectly. It's more, when we finalize the end of the year, there are a lot of purchase orders in place because they are actually paying us behind, like a month behind, and then I still have to take all those monies and send them to the state in the next year. So if those monies are all encumbered, I don't always have enough to fulfill the whole year's worth of appropriations right at the beginning of the year. And then plus, in addition to that, some of the monies that we did receive were a little higher. You know, I base it off an estimate from the year before. And some of the monies that we have gotten in for the tonnage have been a little bit higher. So it's kind of a combination of those two things.
So if they accept more tonnage than what we anticipated, the amount of money that comes in is more than what we anticipated, right?
Right, that's right.
It seems kind of weird that the state makes us front them money instead of them waiting for us to be paid on it.
Well, we are getting, no, the money comes to us first, and then we have, like, I think it's 45 days to turn that money back over to the state. But sometimes I have to have enough in a PO to get me through the end of the year, because I don't know exactly how much is going to come in. And with them being 2 months behind getting, or I shouldn't say behind, like the November tonnage, I don't get till the end of December. So I'm not going to necessarily know how much I am going to have to turn around and pay out from that until I get that November money, and I have to do my budget earlier than that. So sometimes that end of the year stuff just kind of makes it a little cloudy.
Okay, I'm sorry. I guess I was misunderstanding the whole thing.
That's fine. Thank you.
I'll make the motion then.
This is Bob. I'll second it.
Would you like a vote, a roll call vote, Ed? He lost his.
Oh, I lost okay, got it. Sorry. I would like to, please, we have a motion, a second, please take a roll call. I was on mute. Sorry.
Mrs. Boroff,
Yes.
Mr. Logston,
Yes.
Mr. Steyer,
Yes.
Mr. Watson,
Yes.
and Dr. Wolf.
Yes.
Very good. Thank you. Next item we have is the, let me see, double check the agenda. Contracts and agreements, and it looks like we have one here. So it's from the It's with the Lind Media Company for digital billboard advertising. And that's, it says May 30th, 2022 to 11/13/2022, not to exceed the amount of $5,400, and we're the payers. And is this related to the vaccination campaign? Yes, okay, yeah, that's what I thought. So this amount is for the Get Vaccinated Ohio grant, so part of that program, so.
It's not the Get Vaccinated grant, it's part of
Oh.
our COVID-19 vaccination.
Oh,
grant.
okay, so it's that, all right. Very good. So we have an amount of $5,400 for Lind Media Company for digital billboard advertising. Can I get a motion to approve that?
Also move Bonnie.
I'll second that.
Thank you. Take a roll call, please.
Mrs. Boroff,
Yes.
Mr. Logston,
Yes.
Mr. Steyer,
Yes.
Mr. Watson,
Yes.
and Dr. Wolf.
Yes.
Very good. Okay. I think that is where we're at the end of it. It says signing of documents, which we know is kind of all done because of this recording. So don't think there's any other items on the agenda unless somebody
No.
has any other things.
Can I make a comment?
Absolutely.
The next board meeting, are we doing Zoom or at the board department?
Good question.
You're allowed by House Bill or Senate Bill, whatever the number is, to do Zoom through the end of June, but you can always choose to revert back. It's up to the board.
I'd like to go back to live personally.
Is there a consensus? I
Well,
have no problem.
the only reason, this is a stupid thing. But
I'm
the
not
only reason
opposed to
I
live.
asked,
I'm not opposed
I
to
was-
live, but I don't really like to be beat
I
up
was-
on something that we have no control over.
I was delighted this evening because a week ago I twisted my ankle and I'm doing fine, but I did not want to crawl down 2 stairs of steps.
Oh,
Okay.
Oh, but no, don't do it on me. Please, please, please. Decide what works for the board.
well,
In a month, that's fine. It'll be great.
Well, I guess I was absent from the meeting Mr. Watson referred to, but it sounded like possibly security could have been in order at that meeting. And
We should have had police at that meeting.
so that's what I'm wondering if that shouldn't be considered.
Till we get through this process.
You mean, will there be an issue at the next board meeting with people?
A
If
live
there's-
board, if we had a live board meeting,
Yeah,
would it be?
At a
would it be
live
an
board
issue?
meeting.
Yeah, right.
I
right.
can see that, I can understand that. Well, but I have always been involved in the League of Women Voters. And you have to give people a place to say their thoughts, whether they're the thoughts that you like or you don't like. They've got to be able to express their opinion. That's what this country is about.
Right.
I agree.
I think we all agree on that. I just want everyone to proceed civilly.
Right.
That's all.
Right, I mean, per Ohio open meetings law is you have to give people the ability to hear the decisions of the public body. You're not mandated to provide an opportunity for input. Most boards choose to do that for very reasons that Bonnie mentioned,
Right.
but you're not absolutely mandated to do that. And you also have considerable control about how that's done as well, so.
Right.
But I definitely hear the suggestion regarding security, so I can certainly inquire with local law enforcement to find out how what other boards do they do that for? How is it done?
How
I
do they
really
do
don't
it?
know the provisions
Yeah.
for that.
Yeah.
And then the other thing is, I don't know how many people are allowed in that room.
Right.
I
Well,
don't,
and
I don't, there's a, there's
Finite
gotta be a
The other-
fire code. Fire code says how many people can be in that boardroom.
Well,
Sure.
and the other thing that is a concern as a health district, you have to be concerned about the people that are climbing down those stairs and back up them again.
Mm.
I mean, you
True.
don't want any of that. You don't want anybody losing control and falling or tripping or, I don't know.
I mean, currently, that's a great point of question, because our main parking lot should be closed by then. The construction, it was already
Okay.
supposed to have transitioned, but does not appear that they have the back parking lot totally done yet, but it looks like they're getting pretty close. So
Okay,
once it's done, that will become the only parking lot, those spots that are in the back, and the whole side, the main parking lot will be closed.
okay.
So, I mean, they changed the back entrance so that it is handicap accessible. I don't know if there's going to be more than one handicap spot, but they
Right.
did install a ramp.
Right.
We have other issues once you get inside the building, but it does bring you out right next to the elevator. So that's one
Okay.
positive thing. You know, so it makes it a bit more accessible. You don't have to walk as far to get to an elevator
Right,
if you
right.
have mobility challenges.
Well, because of the construction going on, I think it might be wise just to do one more meeting still virtual. That's my thought then. Just trying to get access to the building for people and everything else and ourselves.
I think you're right, Ed. I think one more meeting virtual
And then,
should work.
Why don't we take a vote on it with all 9?
yeah, vote.
And
Everybody- Okay.
Yes, let's
Who-
do virtual next time.
Well, let's just do,
I would do a vote. I vote to have it in person.
you vote right now, the next meeting to be in person. Okay, anybody else?
That's me.
I think that's a motion.
It's a motion. You got a second, you're right. You got a motion to have a meeting, next meeting in person. Yes. They have a second.
Well, we all kind of have to take a vote on it because there's 10 of us. So I don't know how there's only 5 of us or 6 of us present right now.
True.
Right, so yeah, you have a board of 9, so a majority is 5, so it only takes 5 to take an action. So
True.
yeah, it's up
Yeah.
to.
So we have the question about whether we meet in person or we do one more virtual meeting. I could do either myself. I'm okay with that, but I can tell that other people are not, and I'm concerned about the parking access to the building. That's my thoughts.
Okay, I will make the motion that I appreciate Clay's comments on everything, but I would be concerned that we have the next meeting on a Zoom meeting to avoid all the, we don't know what it's going to be, how people are going to park, how they're going to go in, how they're going to go to the elevator, downstairs, where they're going to sit.
Right.
So that would be my motion.
Okay. Anybody else have an opinion? Bill? What do you think?
I won't be a board member next month, so
I
just trying to
apologize.
abstain.
I apologize. So,
I will second that motion.
so you're seconding Bonnie's motion?
Yes.
Okay, all right. Guess we have to take a roll call then now. We got a motion and a second to go with the one more virtual meeting, this next one. Can I take a roll call, please?
Morris,
Oh, she said me?
Yeah, I think so.
Yes, yes.
Mr. Logston,
Yes.
Mr. Steier,
Abstain.
Can't really get a decision.
and Mr. Watson.
Yes.
And then Dr. Wolf.
No.
No. I wish we had more people online in the board participating here, but it sees the yeses for a virtual meeting have one here on this call. So next meeting coming up, we'll do one more virtual, and then we can go to live meetings after that.
Didn't you say it had to be 5 people to carry a motion?
2, 3,
5 out of 9.
5.
Right. We have what, 3 that said yes, didn't we?
And abstain because one is not on the board after this meeting. You're right. So we're back to the point where we already had a meeting scheduled virtually. And we don't have enough people to change that.
Okay. I didn't know if we could talk to the other 4 that weren't here. It doesn't have to be here, but
Well,
whatever you guys want.
Ann, couldn't we do that?
If they vote, it's got to be in public session.
Public
Oh,
Can't do
okay.
an electronic vote.
decision has to be public. Yeah.
Okay.
I'm
Well,
learning these things too, Clay. Sorry.
Okay.
In just some food for thought in the future, is there another venue that would be easy to use and maybe wouldn't
Any
cost
small?
anything, that would be a little bit bigger or whatever, that would lend itself more to whatever kind of crowd is expected?
I mean, the place that comes most readily to mind is whether the commissioners would allow us to use their room. It accommodates less public than our room does currently. It would just have adequate parking, going forward. I'll think further and talk with our admin team to see if they can think of some other locations.
I mean, the last time we had a meeting off campus, I'll call it, was actually on campus at TU,
Mhm.
and they had
That was a great venue. That was a really good venue.
That was, I mean, that's something for the future thought.
All right. Good suggestion. All right. Well, with that, could I get a motion to adjourn?
I will make that motion. Not after I make one more comment. You mentioned earlier that we have some openings on the board, and I just wanted to reiterate that for the people who are out there in virtual land that might be interested in that. That said, I make a motion to adjourn.
Thank you.
thank you.
Appreciate it. Phil, thank you very much for your service on the board too. Really.
Thanks. Phil, it's been a pleasure working with you.
Yeah.
Are
And
you
I have to
leaving,
say the
Phil?
same. Yeah, I'm going to move on to different pastures and maybe work with the Parks Department, look into that more. But hey, 8 years is enough.
They'll have a blessing with you.
All right.
They
Thank
will.
you, Bonnie. Thank you, Mrs. Boroff.
Right.
I have to say, I've enjoyed working with all of you, and I think all of you do a very nice job, and your hearts are all in the right place. And I hope I've done more good than bad in the last 8 years.
Okay.
All good, Phil.
All right.
Thank you.
Good night, everyone.
All right.
Take care.
Bless
everyone.
Good
Keep
night.
safe. Keep
Everyone be
safe
safe.
and solid.
Thanks, Bonnie.
Okay.